after creating a very fantasy version of yourself.
Yeah, it's a real problem. Plastic surgeons are seeing a rise in what industry professionals are calling Snapchat dysmorphia. Now, joining us to discuss the associated mental health with editing your appearance is Dr. Stephen Davis. Doctor, appreciate you being here.
Thank you for having me.
What sort of social apps or media apps are we seeing the biggest issues with this? Obviously, I would imagine Snapchat is one of the bigger ones.
Snapchat, Instagram, things like that where you can actually have filters applied is really causing an interesting situation because, you know, years ago, people would come in with a picture from something on, let's say, Vogue magazine or People magazine, and they'd say, oh, this celebrity, I want to look like that person.
Right.
Now, they come in with their own phones, and they've doctored it up to make it look like they want to look. And they say, that's exactly how I would like to look.
It's crazy.
It is.
It is.
You know, but it's something that just kind of is formed, I guess, over time of seeing and using these filters. Is that correct?
It's true. And the problem with it, so there's a good and a bad with it, all right? The good thing about it is, as a plastic surgeon, I get to know what their aesthetic values are. So I can see they made their nose smaller. They made something else happen, so I can understand that's what they're going for in their looks. The bad part about it is it's an unrealistic expectation a lot of times. So some of the things that they're changing on their face is really not something that can be done easily, let's say. It's going to be a big deal. And I don't think that these younger folks understand what that really means.
But when is it too much? Because all of us, you know, we do a little retouching on some of our photos. But when do you say, okay, you have actually gone overboard at this point?
So I've given you a couple of these signs to look for. But one of the ones that I think out of all the ones that I've given you to really look for is if it's starting to affect your personal interaction with people, if it's starting to hurt you in school or your relationships with others or at work, that's when I think you really have to like step in as a parent or as someone else to really like talk about this. And a lot of times it's really a good thing. I'll have parents come in with their children who really want to do something, and I turn out to be the bad guy. So I have the parents come in, and which is a good thing for me to be the bad guy,
right,
so that the parents come in and go, look, I don't want to have to deal with this thing right now. Please help me explain to the kids that this isn't something that you can just flippantly do.
Right.
So I'll come in and I'll just say, look, you know, you're really much, you know, more wonderful than you expect, you know, based on your photos. Why don't you give it a little bit more time and let's see if that's really what you want to do in a year or so.
I'm curious, how young are you seeing some of the folks that are coming in?
15, 16,
right,
things like that. I mean, it could be even
and
a little...
in some cases, before the body's even done progressing.
Correct. And there's some things that really do need to be fixed. So we see some patients that were born with certain kind of disorders or certain kind of birth deformities, and they, you know, naturally, that's a totally different subject. But what we're talking about here is just things where, you know, it's an unrealistic expectation for what you can really achieve on that filter that they're showing you on their phone.
But do you think that these companies should start taking some type of responsibility for this?
Well, I think that's what's starting to happen. So recently, as of about a week ago, Instagram actually started to talk about doing something. Did you see that? They're starting to talk about, you know, restricting the ages for when people can actually start using some of these filters. And I think it's probably going to be a good thing.
It's something that we probably will see kind of expand a little bit with other social media apps as well. So,
absolutely.
Dr. Davis, an incredibly important topic. Thank you so much for coming in.
Thank you so much. Thank you.
All right, well, coming up this morning, dinner tonight.